does a cat need veterinary attention if they're showing signs of
Immediately.
Okay, so the minute you notice like, hey, something a bit wrong, bring to the vet immediately.
Or you see it squatting, right? And then it only has a few drops of pee. Then 5 minutes later, it squats again and only a few drops of pee. It will require immediate attention because blockages in male cats can be fatal, can be life-threatening.
Let's move on to the next emergency. So breathing issues. What are the telltale signs that a cat is having breathing issues?
For breathing issues, so the most common or the easiest sign to spot is open mouth breathing, panting, shallow breathing where you see your chest movement flutter a lot faster. Sometimes you may also notice a bit of abdominal effort. So your stomach your belly might suck in and out because it has to take a lot of effort to take in a breath. Yeah, so those might be signs that you look out for respiratory issues.
How do pet parents differentiate between panting like after exercising versus breathing difficulties?
Well, you have to judge the situation. For example, did this breathing episode happen after the cat just did a zoomie? Or is it a very, very hot day whereby the aircon is not on, window is open, sun is shining in? Then usually if it's more like a panting episode, it should settle down within a couple minutes or when the place cools down. If it's something persistent, or for example, if you notice the tongue color is a little bit purplish, bluish, then that may be more of an emergency.
Okay. So what are the common causes of breathing problems in Singapore?
Well, some of the common ones that we see will include respiratory issues resulting from heart diseases, fluid buildup within the chest cavity, pneumonia is not uncommon. We do have quite a few cats in Singapore that get asthma. Heat stroke, I suppose, less likely. Most of them are indoors in that sense. So, and cats know that if it's hot, they will find shelter lah. Yeah.
So I can imagine that when a pet is experiencing breathing difficulty, it's very scary for the pet parent. And how should they best manage the pet when they are panting to transport them to the clinic?
I suppose basically you want some kind of good ventilation. So, and then probably to cool them down. So air condition, fan on. I usually try not to advise clients to use those carrier bags because once they zip up everything, it can actually trap heat in there. So your hard case carriers with big openings and ventilation would be more ideal. Yeah.
Okay. And what kind of treatments are used for breathing issues?
It depends what the cause of it is, but the very first thing is actually just oxygen. So when they are rushed in and we do notice any breathing trouble, then the first thing is to provide extra oxygen. So a bit of flow-by oxygen for them to breathe in. Because they are usually in a bit of a panic mode, we will usually give a little bit of like sedative or something to calm them down lah. So injectable for that. And then the rest depends on what the cause is. Then you will try to treat accordingly.
Usually when they experience breathing issue, does it also include very fast heart rate as well? That would need to be slowed down?
I guess it's like a compensatory thing lah. It's like when you are kanchong, then it will go faster as well lah. And plus, you're probably unsure about what's happening. You know, suddenly I'm in a different environment. You know, they will also panic lah. Yeah.
So with breathing issues, also the minute pet parents see like excessive panting that's not going away within a few minutes, it's already an emergency. They should bring immediately.
It can be, and like I say, with that, because it can be fatal as well. If really unsure, then head down to the vet and get a vet to get it checked. Yeah.
Okay. All right. Let's move on to our next emergency. So trauma, accidents, and high-rise syndromes. Yeah. So, what are the critical signs to look for after a potential traumatic incident?
So, I suppose traumatic accidents signs that we look out for would be breathing difficulties, which can result from that. Signs of bleeding, like basically bleeding from any parts of the body. And any form of like lameness, because with the impact of the trauma, whether it's a high-rise incident or a car accident, fractures are not uncommon. So lameness will also be another thing that we look out for.
And what immediate first aid can pet parents provide while on the way to the vet?
So if there's any bleeding and you know where the source of bleeding is, you may attempt to place pressure to help stop bleed or lessen the bleed. If we notice breathing issues, like what we said earlier, is to provide a cooling environment, a well-ventilated environment, and when transporting the pet to the clinic, because of the trauma, we don't know where the injury might be. You may want to place them on like a flat surface, like a piece of cardboard, or like just a carrier base, so that when you move the animal, you don't actually shake them or move them too much. Like if it's in a soft carrier, you actually move them in a way whereby it can hurt them more. So on a hard surface would be good. Yeah.
Okay.
So what if I encounter these sort of cases, right? You know, like is there any number that I can call, you know, for help, or the clinic will send somebody here to help me to, you know, like bring this pet to the clinic itself?
I at this point, I don't think that's very readily available.
Okay.
So for example, if a stray animal or even if it's a pet that got hit by a car or, you know, fell from heights and stuff, the owners are nowhere to be found and you happen to pass by,
Yes.
you can try and call SPCA. They, depending on their availability, because they do have a very heavy flow of work as well, they may come down. Otherwise, the best is for you to try to bring the pet to a clinic for the immediate first aid. Most of the time, I think if you bring it to a clinic, the clinic, without having an owner consent, they will still provide basic CPR or basic sort of stabilization, and then take that time to find the owner and see how far we can really go with that.
Because as a pet parent myself, right, I would love to help, but my concern is I don't really know how to help. I'm worried that I might get the situation worse. Yeah.
Definitely. So I guess, I say, if we are transporting them, a hard surface will be good. The thing is, at that point, right, when it's an emergency, you may not think so much, you know, and the important thing is see how we can bring this pet to, you know, to the right place to seek some help. Yeah.
Yeah. And what are the common injuries seen from high-rise syndrome?
Fractures would be probably the most common. And fractures can be anywhere in the body. It can be, depending on how it fell, head end first, back end first, on the side. So jaw fractures, rib fractures, and then of course with any limbs. So I think that would be probably the most common thing that we see. Because of the impact, I guess things like a lung rupture, bladder rupture, or even a diaphragmatic hernia can happen. Yeah.
So how can pet parents prevent all this type of accidents from happening?
Because in Singapore, we do have a lot of high-rise buildings. And so before you keep a cat, you should ensure that your house is actually cat-proofed. So cat-proofed meaning literally all the windows, the front door need to be cat-proof, whereby you have meshes or you use invisible grill to secure them. Because cats are generally very curious. If they hear or see a bird flying outside, they will want to try. And
they want to be a bird.
Yeah. So then they are also very, they're very flexible. They're very fluid. So even a very narrow gap, right, they will attempt to squeeze through it. And sometimes, you know, you think that it cannot be, like, you see the gap so small. you'll be surprised how well a cat can squeeze through very tiny gaps lah. Yeah. And I realize a lot of owners, I mean, with the cases that we see, they will have like, oh, my whole house is cat proofed except the kitchen. You know, because for example, because kitchen, they find it inconvenient. They got to hang the laundry, bring it in. So that part may not be meshed up lah. So then you might have to do some kind of like a double door system that, you know, your cat cannot enter the kitchen, you know, or there's like a little void area where it can get through the first door, but you'll never get through two doors, you know, to keep them safe lah. Yeah.
Okay, so you mentioned invisible grill, right? So the invisible grill that I have seen, their gaps are usually still pretty wide, right? Can cats wiggle through that?
I think if I'm not wrong, like for like if it's cat proofing, okay, kittens is a different story lah. Of course they will grow. So I think if I'm not wrong, a 2-inch one for a small cat like a 3 kg cat, they can potentially still try to squeeze through. And it depends on the laxity of that invisible grill, because if it's an invisible grill that is supposed to span the whole height, like a human height kind of thing, it will be looser. Then they'll be able to squeeze through. So you have to judge accordingly. Yeah.
Okay. And what are the costs of trauma-related care when they bring to the vet?
So I guess also depending on how high they drop from and whether anything break the fall during the thing. So did they hit something before they fell into the ground versus they went straight down? Cost, I guess, few hundred to thousands to 10 over thousands depending on the damage done. Yeah, so it's always safer to keep them safe and prevent that fall. I know sometimes it is accidents lah, and I do hear cases whereby today got the aircon contractor come, or you know, someone else forgot. But I suppose you have to remember at the very end, you are responsible for your own pet. So if you have workers coming to your house, you got to see how you set reminders, or have the cat locked in a carrier or in one room when you have things going on.
Okay. This podcast is proudly sponsored by Hill Science Diet. A healthy skin and coat is more than just good looks for your pets. It's a vital barrier that protects them from the outside world. But when your pet has sensitive skin, itching, scratching, and discomfort, it can become a constant struggle. Hill Science Diet Sensitive Stomach and Skin is formulated with vitamin E and omega-6 fatty acids for skin and coat nourishment to promote healthy skin and shiny coat. What's more, it is highly digestible for optimal nutrient absorption and gentle on your pet's tummy. Available at pet shops, vet clinics, and online now. Okay, let's move on to our next emergency, poisoning. Okay. So poisoning is another frightening emergency that I'm also very curious about, because there's so many things that could potentially be poisonous to our pets that are not poisonous to humans, right? So what are some common household food or toxins that pose a risk to cats?
Well, things like our regular household cleaners and stuff in concentrated volume or whatsoever can be poisonous. Plants. So we in Singapore, most of our house will have some form of plants. So you should be checking whether the plants are poisonous. So for cats particularly, lily plants, eucalyptus, onions are actually all toxic. Certain medications like Panadol, you know, so then we always also remind people not to self-medicate if you're unsure. Essential oil is also another thing that we use commonly in our household that can be poisonous to the cats.
Essential oils, does that mean like as a whole or certain types?
I think for inhaling wise, like if you have like an aromatherapy going on, inhaling, I guess as long as it's not as toxic as, for example, they can come in contact and they actually lick it, or have the essential oil coming in contact with their body, that probably might be more of a bigger worry. Yeah.
Okay. Any household or any food that's very common that we eat that are actually very toxic for cats? You mentioned onion. Any others?
There are quite a lot lah, and sometimes I will have to also check. Garlic, chocolate, like gummies and stuff, all contain toxic compounds. Yeah.
Right. So households who have this food, which is almost every household, right? They should really store it inside the cupboard and not like at the kitchen countertop, because cats, they can jump very high and
They
they
can.
explore really great areas. So
I think a lot of these food potentially, so you need to keep it away as best as possible. Cats, I think unless it's cats can be very fussy also. So some of these, unless being offered, I think they will also avoid, or like, I don't see it as like, I think like you've got a raw onion and stuff, I think it's quite unlikely for a cat to want to bite into it lah. Yeah, so I think as long as we try to keep it as best away from them, have it covered, I think we should be good.
Okay, that's great to know that they don't tend to go into those things. I think not as much as dogs lah, huh? Dogs are usually more.
Yeah, I suppose. Yeah.
Okay, and what are the signs of poisoning in cats and how quickly do they appear?
I guess depending on the dosage of the poisoning, I guess the most common one will be vomiting, diarrhea. Certain toxins can also cause tremors, seizures, and in severe case, they can collapse from poisoning as well.
So if a pet parent suspects, like, okay, I suspect my cat may have come into contact with a lily, so what should they do next?
Because lilies are actually very toxic to cats, every part of the lily can cause toxicity. They should bring it to a vet clinic to get some checks done. Lily causes kidney failure. So at the vet clinic, the vet might warrant blood tests. If it's something that's immediate, we might be able to start them on fluid therapy. We might be able to give some like activated charcoal and so forth, or like some kind of gastric lavage under anesthesia. So it does depend on what the toxin is lah.
So what if my cat ate a small piece of chocolate? So should I observe or should I bring them immediately to the vet?
For chocolate wise, it's ingredient in chocolate that causes the toxicity. So it depends on what kind of chocolate. Baking chocolate, dark chocolate can be a big concern, so they should be brought into the clinic. If it's a very, very tiny piece of milk chocolate, like white chocolate, perhaps it may not be such a big concern. Yeah.
Okay. All right. So let's move on to seizures. Yeah. All right. So what do seizures look like in cats, and how do pet parents differentiate them from other neurological issues?
So essentially, a seizure is uncontrollable muscle activity. It's a little bit of a disruption to normal brain function that controls the muscle. A cat may fall onto its side and have uncontrollable sort of like pedaling. They can lose control of their bowels and they might urinate as well. That's usually like a full seizure. A part seizure can be, for example, just twitching at the face, and things like that. So if it's more tremor kind of thing, it will also subside very quickly lah.
Are all seizures considered an emergency?
If a seizure just happened for the very first time, I suppose we should still seek attention to determine if we can find out the cause of the seizure. But otherwise, depending on the severity of the seizure, for example, if a seizure happens for more than 2-3 minutes, that might require attention. Or if a seizure happens frequently in a very short span, like example, 3 seizures in 1 hour, that will require a visit to the vet, because it can continue on. And when you've got seizures so frequently, I suppose you can get brain damage. You can end up with a heat stroke as well. Yeah.
And what are the potential causes of seizures in cats?
Well, seizures in cats can be because of things like liver, kidney failure, low blood sugar, low calcium levels. They can also be caused by some kind of brain tumors and things like that. Yeah.
So what should pet parents do during and after a seizure?
During a seizure, actually you can't really do anything.
Oh.
Yeah, I mean, they always say, you don't have to worry about things like they'll bite their tongue or things like that. Maybe important thing is to prevent them from injuring themselves further. For example, if they're on a chair, on a table when they were seizuring, see how you can avoid them falling off the table. If they're on a very hard surface or near a sharp edge or anything, prevent them from hitting those surfaces. So it's more to prevent them from injuring themselves further. You can't really do much about the seizure unless it's like a repeated event and you've got medications from the vet to give when a seizure happens. Yeah.
But if the pet's got seizure, how long will be the seizure stay there for?
Usually seconds to couple of minutes.
Oh, okay.
Yeah. So depending on the severity, sometimes it's just a few seconds, less than 10, 15 seconds. Sometimes it can drag up to a couple of minutes. Yeah.
So when the pet, let's say the pet has a seizure on a table and you're afraid that the pet will fall down, right? During the seizure, can we carry them to the floor or is it very unsafe at that point of time?
I think it's still possible, but because everything will be like in a panic mode, you see, so you may end up just standing at the edge or see how you can block it to prevent it from falling. Yeah, but I mean, when it happens, I think some people weren't there lah, but you can probably just lift it and place it on a carpet or something. Yeah.
Maybe we take a towel and wrap it up, when they're having seizure?
It is possible, but again, when you have seizure, it's uncontrollable muscle activity. So you actually get quite heated up. So if you wrap it in a towel, but if it's for a short period, I think it's still okay. They might get overheated. Then you end up with like a heat stroke problem after that. Yeah.
Would a seizure cause like self-inflicted harms?
Unlikely.
Okay.
Unlikely. Unless they, like I say, if they tremor so badly that they, hit onto the hard surface, a sharp surface, then they might cause some external injuries. But otherwise, not really.
So if a pet has seizure once, would it be likely that it will happen again?
Depending on the cause of it. Right. So it is important to then investigate what causes the seizure. Because if the underlying issue is being dealt with, then it shouldn't recur. But there are many cases whereby they may require long-term medications to manage the seizure. And it doesn't mean that once they start the medication means they won't get any seizure. It's more like it used to have, for example, 5 seizures a month. Now with the medication, only maybe 1 seizure a month. So it's more like managing, reducing the frequency of the seizure, the severity. It used to last 2 minutes, now 30 seconds. That kind of thing. Yeah.
Seizure is more like a genetic thing, or it's because it's due to the food that they eat?
Food-wise, I don't think there is a problem associated with the food unless it's poisoning. Because just now we said poisoning can also cause seizure. Genetics, I think it's more an individual thing. There is a category of seizures that we call idiopathic seizures, which means we also cannot find the reason for, and we just end up using medications to control. Basically, we try and rule out everything else. So liver, kidney, blood tests all normal. Then you go for MRI scan, everything also normal. Then we will just treat it as idiopathic. Unfortunately, we don't know the reason. We just manage the symptoms.
So what diagnostics and treatment is usually done for patients with seizures?
So diagnostics wise, like I say, when you first go into a clinic and your cat has a seizure, we will usually try to run some baseline blood tests to know how things are going, making sure the electrolytes are normal, like calcium level, We also want to make sure glucose level is normal. Then liver, kidney, because like in severe cases of liver disease or kidney disease, seizure can happen as well. If we don't find anything, we will usually recommend to see if the client is keen to work up the case a little bit more. So we'll refer out for a proper like a neurological assessment. Then at the hospital setting, they might recommend an MRI scan to see if there's any abnormality they can detect in the brain, like microtumors and things like that. Then based on that, to justify is surgery a possibility or it's going to be a medication thing. Yeah.
So like you mentioned just now, medication would be something that is more long-term that they will probably have to take.
Yeah. So I think if a cat is known to have seizures, the vets may prescribe like a couple of doses of diazepam that they can give rectally when a seizure event happens at home. That will be more the immediate thing before they can go to a vet clinic, or it's just to manage it because it happens infrequently. Then on a longer term basis, they will need daily medication, usually twice a day to manage the seizure. Yeah, so for seizure medication, they tend to be lifelong, unless the seizure frequency really reduced so significantly, then there might be attempts to taper down the dosage or frequency.
Okay. Thank you so much, Dr. Kitty. We really learned a lot today with the 5 types of emergencies. I'm sure there are much more emergencies as well that maybe we can leave for another episode.
Sure.
Yeah. So I guess what we also really learned today, something to really take back is that with emergencies, it's important to give your vet a call and then the safest is to bring to your vet if you see that symptom persisting.
Yeah, definitely.
Yeah. All right. Thank you, everyone. We've come to the end of the episode. We'll see you in the next one.
Thank you.